The primary objective of the Mobile Diabetes Clinic is to really elevate the health status of people living with diabetes and at risk for diabetes. We target First Nations communities, and we know that if we can increase access to specialist care and to overall health care, then that we can prevent many of the complications associated with diabetes further down the road. When we think about things like amputations and kidney disease, mental health, if we can increase people's access, which is what our clinic does, at health fairs, at annual diabetes clinics, at follow-up phone calls, at one-to-one visits, if we can reduce barriers to care, we know that we have played a role in bettering people's health long-term. Someone with diabetes, to get access to a diabetes clinic or to a kidney clinic, you have to make an appointment with someone in Vancouver or in Prince George. What we bring is our service on wheels. So we have a lab. So when people come to see us to get their blood done, we process those results sometimes within 6 minutes or sometimes within 45 minutes.
My favorite part of working with the Mobile Diabetes Clinic is the ability to be able to work with people, and the opportunity, I guess is the better word, to work with people to help improve their health, but just sort of walk with them on their journey to getting there. It is their journey, but I'm able to sort of support them, to give them the tools or maybe the way to access things that are often difficult for our community members that are, especially who are really remote.
You know, being able to go to the communities and being able to, do all the point of care testing right there and then, it helps us make those connections with our patients through various resources like our phone, Zoom, video calls and stuff like that. That's the other part of the that I really like about this job, is how appreciative all the members of these communities, of these different nations are. It makes me want to go back there. All the love and appreciation that we get from the community's members, being able to make a difference in their lives.
Normally, somebody in a non-mobile diabetes context would have to access all of those appointments over the course of a couple months. And so when we talk about breaking down barriers, we're talking about bringing services to people. Instead of always waiting for someone to book an appointment with us, we actively outreach. We know that health is very linked. We know that good health care must be holistic in nature. When we sit down with somebody with diabetes, first of all, we have to gain trust. We have to build a relationship. But along the course of that journey together, mental health comes up, kidney care comes up, substance abuse may come up, sexual health may come up. If we take all those categories together, we start to build a holistic picture of health, right? So it may be that somebody they want somebody to help them to bring something up with their doctor. We can be that person. It may be that somebody just needs someone to talk to.
Even today, they asked me questions about how I'm doing. I wasn't doing too well, and I let them know why. At least I can let somebody know. Whereas I call it living out in the bush, you don't always get somebody to support you in whatever way you're feeling, or to give you pointers on what to do, maybe. Like the other day when I was feeling worse than today, and they asked me if I wanted to get mental health or assistance. And I said, no, just them talking to me is okay to bring me back to point one and what I should be doing. Yeah, and they're doing a wonderful job, and to keep it up and hope to snag more elders than me.
So with the Mobile Diabetes Clinic, it allows us to learn about people's culture. It allows us to experience different geographies. It allows us to help people gain an elevated health status. And if that doesn't bring joy to one's heart, then I don't know what else would in this job.